Flu, colds, viruses, all can occur because of a weakened immune system. Dr. Tracy Linhart from Peaks of Health Metabolic Medical Center is back to explain why this is, and I think most importantly, how they can help. Dr. Tracy, how are you?
Yeah, we're getting a lot of that right now.
It is. I mean, it's taking over the headline, and people want to do what they can to stay healthy, and especially prevent this flu from happening. How can you help?
Well, it's been tough. I mean, I still do emergency medicine, because I'm board certified in emergency medicine. I worked in the ER for 18 years before I left. And so we run an urgent care room in our office for our private patients. We were getting 3 or 4 patients a day coming in thinking they had the flu. Now, not everybody does, because that's going to be the sudden onset of high fevers, body aches, that kind of thing. Some people just have viruses. But there are a couple things you can do proactively. You can do things to boost your immune system. Obviously, if we're stressed out, we go through vitamin C because our adrenals like that, but that's also what we do to fight viruses with. And so if we're low in it, we're going to have more options to get in the flu. If your vitamin D levels are low, vitamin D stimulates our immune system, and studies have shown, they actually did a study on this with young, healthy people where they got their vitamin D levels over 60, and the other ones were normal, 30, 40s, injected influenza up their nasal passages, and everybody over 60 never got the flu.
Really?
So this is some things we can do, and we actually will give vitamin D in our office. If somebody comes in sick, we'll give them an injection of a high dose of it just to stimulate them and get their immune system going. We'll do IV vitamin C, viral IVs, to kind of, again, give that vitamin C back to the body so the immune system can hit it itself. And that works very, very well. Now, somebody has real bad flu, Tamiflu is the prescription we use, but it causes a lot of nausea and some people can't tolerate it.
And I have heard that, by the way, people have flu and then they're sick there. So you're talking about getting that immune system stronger. Now, you mentioned stress. I always think stress, I always think sleep. Can sleep affect our immune system? Or what
sleep has been shown to reduce your immune system by almost 30% just with 2 nights missing sleep. And that was, studies done on people getting less than 4 hours of sleep. And in those 4 hours, they looked at what we call T helper cells, which is your immune system, and they dropped by 30% just after 2 nights of lack of sleep.
And, we're sitting here talking about the vitamin C, the vitamin D, lowering stress. I mean, that sounds all wonderful. Are there any other tips that people can keep in mind during this stressful time that it always is for most of us?
Well, again, we know our guts are 70% of our immune system. So if we're eating a really poor diet at that time and, taking probiotics to keep your gut healthy, those are all things that are also going to boost your immune system. So, we do a lot of things. We look at people's gut health, we look at their vitamin D levels, we look at their immune system, we look to see what's going on, and then we give them things that can help boost it up for them. We also have natural antiviral stuff that we use, natural antiviral medications. So if they can't tolerate Tamiflu, there's some herbs and things like that that are very helpful for the immune system.
And I know in getting to spend time with you that you look at a person, not overall, you look at them on an individual basis and are able to come up with their treatments. Is building their immune system the same kind of thing?
It is. I mean, a lot of our patients that are chronically fatigued, we look at natural killer cell counts. So we go a little bit further than just a white blood cell count. We go deeper into that. We actually look for those helper cells and the complement levels. And what that does is it tells us what's really going on in their immune system. Is it suppressed? Because if that's suppressed, they're going to be more likely to get sick. We do find people with primary immune deficiency, people that were born without good immune systems and nobody ever looked to see. And these people complain that they've been sick all their lives or they've never felt good all their lives. So when we find that, it's like you can treat them by giving them that actual immune system back into their system. It's called immunoglobulin. But, it's amazing how many people we have found in their 20s, 30s, 40s, and 50s that were never tested for their immunity to see if they actually had an immune system.
Interesting. So that's where don't just wait till the symptoms come on. You're saying contact now, start a relationship now, and you can even prevent those sicknesses from coming in the future,
I mean, if we
right?
catch somebody in the first 24 hours of that flu, we can usually turn that around. We can usually stop it from progressing, and therefore they're not down for 2 weeks. If you're waiting a week and you've been sick for a week, it's going to take a little bit longer to turn your system around.
Good stuff, as always. I appreciate when you were here every time. And if you're interested right now, Dr. Tracy Linhart has a special offer for you. As a matter of fact, you can go and talk with her for 15 minutes free of charge. There's her website. There's her phone number. Get in touch if you want to boost your immune health or just get into your optimal health overall. Thank you so much for coming in.
Oh, you're welcome.